Hello and welcome to your first simulation experience. My name is Sarah, and not too long ago I was right where you sit now. We are so excited for you as you begin this unique and engaging learning experience. We want you to know that this will be challenging but also fun. Here you will learn in a way that is proven to improve your critical thinking. You may be wondering, is this like school? No, it's not. This is a no judgment zone, and your facilitators are here to support and guide you as you participate and engage in your simulation experience. You will find this a very different sim than in school, so take a deep breath and don't feel anxious. Oh, and no, it's not an escape room either.
Thank you, Sarah. On behalf of the clinical education, medical simulation, and clinical experience teams, we want to tell you how excited we are that you have joined AdventHealth. We know this is a time of adjustment and learning for you. Our purpose and hope are to assist you on your journey to independent and safe practice with the nurse resident clinical immersion simulations. Here, you will begin to refine and enhance your clinical judgment, which will give you added confidence as you complete your training on your unit.
Yes, that was a major benefit to me as a new AdventHealth employee. Today, you will participate in 3 simulation scenarios. These simulations are designed to give you the opportunity to practice clinical reasoning skills, implement protocols, and perform interventions that may be new to you. You'll be able to explore clinical options and stretch yourself in a controlled environment with no stress or fear of affecting a real patient. If mistakes are made, they are simply opportunities of learning, and you'll be able to explore and clarify these in the debrief process immediately following your simulation scenario.
Now you may be wondering how your simulation sessions will be structured, and for that, we're going to turn it over to Eric, one of our simulation operations specialists. Eric?
Thanks, Becky. First, you will be given an orientation to the simulation room. The human patient simulator, or mannequin, the equipment in the room, the telephone, the process for obtaining supplies and assistance will be explained to you in detail. Second, you will be given a report on your patient by one of your facilitators. You will have access to the patient's charts and will have time to look over it and review it with your fellow learners. Third, you will begin your simulation experience. Patient care will occur in real time. No fast forwarding. Your facilitators are always here to assist you should you need their help. Just like on the floor, use your resources. If you need supplies, medications, equipment, you will be able to communicate with your facilitator through the Spectra link and obtain those items. Your facilitator may come in as a member of your team, your charge nurse, RT, tech, to bring you additional material needed as the scenario progresses. There will also be role players that come in playing the parts of visitors or family members. It is vital to the learning experience that you communicate with the human patient simulator as if it was a real patient. That is also true of the environment. The team has done everything we can to replicate a patient room on a clinical unit. We do, however, realize that there will be some differences. Please focus on the foremost objectives of the scenario, which are assess, interpret, and respond to the changes in the status of the patient and execute the care plan for a patient with the change in status. Don't worry, your patient will never code in sim. That is our promise to you. No one dies in sim, not even you. Your facilitator will let you know when your scenario is complete with a distinct knock on the door, entering and stating the scene is over. Lastly, you will engage in a debrief process with your facilitator.
I'm just grateful for the struggle, the information, the ability to debrief, not just the simulation situations, but real situations that happened.
I really loved the debriefing process. It was a purposeful conversation. We were able to discuss our thought processes, our clinical reasoning, actions, and any concerns or feelings we had about the scenario with each other and our facilitator. It was a great opportunity for self-reflection.
Though you will not know your patient's issue in advance, you will have the tools you need to assess and respond. The scenarios that you are going to participate in are based on this concept map, which illustrates the steps you want to take when managing a change in your patient's condition. Your first step is always going to be performing the nursing assessment. You'll want to consider things like vital sign trends, lab results, diagnostics, I&Os, and provider notes. Try to construct a picture of what may have led to your patient's current condition. Why are they experiencing this change? Is it a new problem, or is it related to a prior existing condition? Did something happen in the last 24 hours that may have impacted your patient's status? Now that you've analyzed the situation, you need to focus on stabilizing the patient. Think about your ABCs. Is your patient adequately oxygenated? How is their circulation? And address their immediate needs. You will then want to develop a treatment plan. This could be by using an existing protocol or contacting the provider for new orders. Don't be afraid to ask for help in these situations. There are no inappropriate questions. Every treatment plan needs to have a follow-up. This will include reassessing your patient and their response to treatment. Consider what you're monitoring for and how you can prevent it from happening again. Remember, there are elements you need to be thinking about through this whole process: patient safety and infection prevention and communication with your patient, family member, and other healthcare team members. The patient's experience is an essential part of the care plan, which should always consider the unique needs of your patient and family members. At AdventHealth, every interaction should support our mission, which is to extend the healing ministry of Christ. Now, go save your patient and have a good time.
Hold on now, we do have a few guidelines. Always remember to conduct yourselves in a professional manner. These scenarios are recorded. Refrain from cell phone and smartwatch use during the simulations. If you have an emergency call, please notify a simulator facilitator or one of the techs, and you can step out of the room. Food and drink are to be kept outside the lab at all times. Please remember to use gloves when handling the human simulators, as the oils in your hands may damage the simulator skin. Pencils will be used in place of pens because we don't want to give SimMan a permanent tattoo. Right, SimMan?
Right.
Lastly, you may be wondering about that confidentiality contract you signed. As a new member of our AdventHealth family, we ask that you live out the values of quality, service excellence, and community well-being by keeping the details of these scenarios confidential. These scenarios are used in multiple training programs and were developed through collaboration with multi-department teams to meet current administrative, educational, and public health priorities. To provide the best learning experience for every nurse who may participate in these simulations, you're required to keep the details of the scenarios confidential. If participants are found sharing details of the scenario, such as disease processes, expected interventions, your department leadership will be notified for follow-up. Though the sequences and progression of these scenarios must remain confidential, we do encourage participants to share the benefits experienced during the simulations.
So, some of the benefits of walking into simulation without knowing what the scenario is about is it helps you to use your critical thinking skills. It helps you to think on the spot and to know what you know and to work on what you don't know. It's not like sim at school where you're nervous. You have a team of preceptors here that are very supportive, and it's not nerve-wracking. It's not as bad as you think it is. Just breathe and you'll get through it.
Welcome to our team. We know you are a valuable member and look forward to seeing what you will become. Please make the most of your simulation practice, as it is a pivotal step in the nurse residency program. Your commitment to our service standards of love me, keep me safe, make it easy, and own it will ensure all patients feel our organization extending the healing ministry of Christ. Now, go save your patient and have a good time.